Also new tonight, Connecticut is facing a massive child care staffing crisis. Today, politicians, parents, and providers met to talk about how child care is funded in our state. News 8's Brittany Taylor has more on what's being done to try to solve this problem. Brittany.
Yeah, good evening. The state is in dire need of funding to support families and child care providers. And we spoke to one provider today. They say that they are barely staying afloat.
Toddler Town in Waterbury recently opened in February. Already, it could soon close. Owner Steffi Martinez-Frias currently isn't paying herself, and she can barely afford to pay her staff.
There has been weeks where I almost didn't make it for salary, for staff payroll. And it is heartbreaking because we are offering a service to our community that it is needed.
Seema Timal has been a child care worker for over 25 years. She is getting paid just over minimum wage.
The pay is not the greatest. I think we should have some more pay.
That pay is the root of a nationwide staffing shortage in the child care sector. Senator Richard Blumenthal says there are 48,000 vacancies across the country and around 4,000 here in Connecticut.
We're in the midst of a child care crisis because it is unaffordable and unavailable to millions of American families.
Unfortunately, we have to depend right now on the federal government because the legislative session for Connecticut is over. It ended last Wednesday. We were not successful to get enough funding to give those extra slots. You know, the money's just not there.
With mass staffing vacancies, advocates say centers are unable to functionally operate, and that is having implications for parents like Stanley Richard, who has 8 kids.
It's hard to get childcare, especially when you have a lot of kids.
It's why many turn to Care for Kids, a state-sponsored program that helps low-income families pay the bill. But advocates say there is currently a wait list of over 1,500 children, forcing parents to choose between working and taking care of their child.
So maybe on paper, it's yes, you get to be on the program, but they're on months waiting list before they can actually get on because there's not money to pay the providers for that slot.
And Bermuda's Zimmerman says Connecticut is expected to get a $5 million federal grant. At this point, it's unclear how those funds will be disseminated. We did reach out to Care for Kids, but we haven't heard back at this hour. Brittany Taylor, News 8.